Hi everyone. Hello.
Hi.
My name's Rashida. This is my first year at MFP.
Welcome.
Thank you. I'm a PhD candidate as of last month at the University of Pennsylvania. And I'm super excited about our next talk. It's on media and how to be nurses in media. So I'm excited to present Barbara Glickstein. She's a public health nurse, media strategist, and the principal of Barbara Glickstein Strategies. She works to promote and amplify the expertise of nurses to support the health of the public. And she also works with journalists to find nurse experts as sources for their health reporting.
Thank you. Hello, everyone. I just am so glad that I was able to arrive yesterday and be there during your talk about the legislative day on the Hill, the seat of power that you each also own, that seat of power, and as well as having some chats already this morning. I've been thinking of you all better start pitching me to be on my radio show because your stories I must tell, even if you don't live in my state. I will hook you up with other journalists throughout the country. I'm a member of the Association for Healthcare Journalists, and they call me for sources. So now I have your bios, and when they ask, you know anybody in the state of Nevada, I'll say not only did I meet her, she's going to run for office one day. So thank you. And you've been warm and welcoming, and I'm just really thrilled to be here. I want to thank Cornell and Samuel, the tech folks, who always make me feel solid as I stand up here, and to everyone on the team who brought me here, made sure that I had a beautiful room and enjoying meals. So thank you to the staff who made this possible. So I'm going to just show you, kind of like we talked about, Representative Canada talked about boldness. So I want to tell you how I got into media. But I first want to tell you that I come from a working class family. My father drove a truck. My mother worked in a factory making hair bows. And I had the best seconds from what they couldn't sell. So I had the best headbands and bows ever in grammar school. They also were community activists. I was taken as a child, as early as I can remember, door-to-door to voter registration in our community. And as soon as I was 18, my mother, who worked on the election board, got me a job, and every election I worked at the election board. I have never missed an election in my, now since 18, I'm 69, I've never missed an election, a primary or an election. So I urge you to follow up on these ideas of how to get other people to vote. So this is a short video I want you to hear. I think we need it a little bit louder. It's sorry. Whoop. All right, you know what? I'm going to tell you the story instead. It's okay. Let's not. I'm in radio. This happens all the time. You just move right on. So I'm going to tell you the story. In 1985, I was a second-degree student at NYU. There wasn't an accelerated BSN program, and I went into that program. I already had a biology degree, and I said, I want to become a nurse, but I'm not taking all those science courses again. The dean said, you have to. I said, no, let me sit for every exam that I have to pass. I did, and I managed to create my own second-degree program. But that's not the point. In my leadership course, I decided I wanted to make a documentary about nurses in political action and their influence as change agents. And Dr. Connie Vance, some of you may know, I know Dr. Outlaw does, she's a world-renowned on mentorship. She looked at me and said, have you ever made a video documentary before? And I said, no. And fortunately, she said, okay, that can be your senior project. So I went with when the video cameras were like this big, literally, 2.5 feet long. And I interviewed 4 nurses in New York State that were doing amazing things around working to change policy. Peggy Rafferty was one of the nurses. She was doing street nursing when we early on were learning about dual diagnosis, which was in 1985. They were nurses working in the street, recognizing that many of the unhoused people had mental health issues that were never identified or treated. And she then became part of the organization called Coalition for the Homeless. She was the only nurse in that coalition. She wrote a curriculum for all the volunteers on how to interact with the unhoused people on the street with mental health and substance use problems. So Peggy and I are still colleagues and friends, and I'll let you know about her later on in the program. So as you all know, our nurse representative, Lauren Underwood, has said nursing is political. And we know that she is making amazing strides in our government as a nurse legislator. The Momnibus bill that she's the co-author of, and many, many other things. So I'm going to run you through what might be, for maybe in the future, a full-day workshop. But I think if I help you build on your media competencies today, everything that Representative Cannon said about running for a campaign, running to be on a board, running to lead on an association that you're involved with, and even running a meeting. I can tell you that I've done media training with Dr. Diana Mason, my partner and coworker, and we would, one time, a CNO was in this training and she had to leave during lunch to run a board meeting. And she said, I'll be back in an hour and a half. And she came back in an hour, and we were like, oh, that's great, it ran fast. She said, I took these skills on the way there. I had to take a taxi. I redid all my notes. The meeting was only an hour, was 45 minutes actually, and I got to every single point. So what this will also do is help you in perhaps your research, perhaps in teaching. It really helps you think about what's important and how and what do you want your audience to do. So what do you think? Are nurses unheard, or are we not putting our voices out there? Anybody?
No,
We're not putting our voices out.
Okay, so can I get a raise of hands on a commitment that you today, going forward, are going to put your voices out there? Higher, higher. Come on. Okay, I see a few. All right, we're going to work on everybody. That's good. Okay, here's a quick poll. Yes or no, and I'll go with yes first. Does this next picture express how you feel when you're asked to talk with a journalist or the media, or when you just think about the idea of doing this? Okay, here's the picture. Let me see, is there a yes? And is there a no? You're all cool, you're good. All right. Okay, good. So we're going to build on all of this. And I think less and less of us are feeling this way. I also want to tell you I've been producing and hosting radio for 40 years. There's something about being excited that sometimes we say we're nervous. And growing my kids up, I used to say, you're not nervous, you're excited. It sits really close in your belly. You think you're nervous, but you're excited about going in and doing that poster presentation in 3rd grade. And I use that for you all as well. Sometimes we're excited, but we don't want to say we're excited. So we say, oh, I'm really nervous about that. Nah, you're not only nervous. But every week when I produce, or if I'm live, even this morning, I have like a little thing in my belly going, oh, I hope I do a good job. I hope I do well. So we all feel it. So what are some of the fears? Making a mistake, forgetting what I'm saying, looking foolish, being misquoted, not knowing something, and certainly fear of losing my job. So I don't have a lot of time to go into the weeds on this, but you need to know the media policy of your institution, certainly of the fellowship, and certainly of any organization that you are speaking about and for. And I would urge you to know that, whether you go and talk to journalists or not. You will learn even about their social media policy, and we know certainly also during the height of the pandemic that there were nurses, more nurses than we hoped for, who lost their jobs, but they were speaking out about not having PPE and their safety. A couple of those cases went to the labor board and they have been reinstated in their jobs. But you don't want to speak on behalf of your organization without them knowing, and you can speak as a private citizen without mentioning that affiliation. But even in those instances, know your policy of where you're employed, or even as a student now. So let me hear very briefly, why do our voices matter in health news? Why do our voices matter in health news media? I think we got some good foundation this morning from Representative Cannon. Please.
Patients trust us, and we can voice their concerns and their perspectives and serve as a bridge from.
Exactly. Who else? Yes.
We're on the front line. We see it day in and day out.
Exactly, please.
And we have many data points.
That's right, we have the data points. We are, oh, somebody else wanted to say something. I saw a hand.
Danger of a single story.
There we go. We're great storytellers, and of course we understand HIPAA. We would only share a story with a patient content that protected their privacy. Or many nurses I know now who are doing media training are asking permission of a family whose case or story they'd like to use with their approval. So there are times that you can use that story with their permission. But you're all researchers and you're all scholars and you know that. Just a reminder. So here we have visibility, public trust, our unique perspective. Many of these things have been said. And this is a quote by Diana Mason, my colleague. If you're not interviewing a nurse, you may be missing the best part of a story. So we know from our experience, both with working with journalists, being reporters ourselves, that our job is to amplify your voices. And when we do, the public is benefiting from it. So it's not just about showing the world who we are and what nurses do, but your focus really should be on the people you serve. And in doing that, you are elevating the image of nursing, and not only the image, but the knowledge that the public has about the breadth and the depth and the visions and the dreams and the solutions that you have. So I'm going to briefly run through the high-level themes of a study that we did called the Woodhull Study Revisited. Back in 2018, which for some reason, because of the pandemic, feels like 100 years ago. I don't know about you guys. I was like, oh, that feels really old. This is the team that I worked with. I can send you this so you know who they are. We worked with the Berkeley Media Studies Group, and I was then at the George Washington University School of Nursing Center for Health Policy and Media Engagement, which you should know about because they have fellowships. They have a media fellowship. They just announced their new cohort for this year, and I would urge you when you have those 5 minutes that you all searching for to run for office, that you may want to do a media fellowship as well, and I know that you are interested when you get there. So this study was a replication 20 years later of a study that was done because of the interest of Nancy Woodhull, who was herself an editor at a major newspaper, who was public about this. She was living with cancer. She was living with breast cancer and hospitalized. And her personal experience made her realize that she had no understanding truly of what nurses did. And so she went to the University of Rochester, where a study was done on print newspaper. And we replicated it in print. We did not do digital, which is a study that we hope to do in the future. So we looked at the same publications, if they still existed. Unfortunately, a lot of newspapers have shut down. Weekly news magazines and healthcare industry publications. And we saw this data. Laura Nixon was the top researcher on this project. So only 2% of our quotes were in healthcare articles, 4% in weekly news, and 1% in our own industry, not nursing journals, but the health industry journals. So we remain invisible. And I think it's ticked up a little bit, and that's the study we're trying to raise funding for, to really look at what happened during the pandemic. We know that, as I mentioned, nurses were speaking to the media and posting on social media about the lack of PPE, the way that they innovated, right? The ways that they did during taking care of seriously ill patients, what the innovations were. What we didn't see was a lot of expertise, we think, anecdotally, and so we didn't do the research yet, is that after the lack of PPE or the PPE with the mask off and the indentations from wearing the same mask for 12 hours, we didn't hear about their infectious disease expertise, their respiratory disease expertise, and on and on. So we think the public got to see us, but we didn't get to really talk about the research. We didn't really get to talk about what we were doing that really made a difference. So they were very emotional stories. Again, I'm not criticizing it, but we need to move past that to the depths of your research to advance and health equity, to advance mental health parity, etc. Nurses were mainly quoted about the nursing profession. So that's okay, but we can't just talk about nursing. Most editors will say, why do I want to publish that article? Remember, journalists have to go to their editor to pitch the story. You want to make it about the people you serve, the populations you serve, the communities you're serving, not about us. They were identified in many stories that they should have been in. This was during the time, still with the previous president, whose name I won't mention, was trying to rid the Affordable Care Act. He was trying to remove it. And nurses were not quoted in one article about the role of the expansion of affordable care and what it did for communities. We were never sourced in anything about health policy. And our second research was talking to health journalists about what's it like when you interview a nurse. Why do you use nurses? If you use a nurse, what happens? You know, what's your story changed? And this is my research team, Dr. Kristen Westfield, who's now out at UCLA, who's a pediatric nurse practitioner who had her own children's radio show on public radio in Cincinnati when she was doing her postdoc, and hopes to get back there one day, but right now she's in that, I'll say it out loud, tenure track monster and can't do anything besides research and publication. That's me in the white glasses. I've changed them to tortoise, and Dr. Mason. So these are some of the overall themes. Biases about women. I'm respectful of those in the room who I don't identify as women. Positions of authority in healthcare. Journalists in the journalism room, in the newsroom. We learned that public relations staff at hospitals, at major academic centers, at universities with schools of nursing, when a journalist called and said, I'd like to speak to a nurse specialist in cardiology, were sent to the School of Medicine to a physician and never given a nurse, even if they asked twice. So the conclusions are we remain invisible, improving health reporting is dependent on addressing these barriers. It'll require all of us, newsrooms, editors, PR departments, professional organizations, fellowships, and any other ways, and certainly you. So here's my passion. I want to see a more diversified source in everything that I read about the news, right? I want nurses' stories to be told by nurses. I want nurses' expertise to be told by nurses. I want to see a variety of people in the TV news. I want blogs, I want online digital reporting to call you as sources and others who are not represented in the media. Because when journalists do, the public, when they better understand these issues through your lens, through your scholarship, the public will better understand it. Right now, with all due respect to our physician colleagues, it's mainly white physicians who, when they're called, even if it's not in their lane, so to speak, they'll say, oh yeah, I'm available at 5 o'clock for CNN News. And then they'll do that Google search and speak to that issue. Sometimes we can do that too, but most of the time, my experience is nurses who maybe it's not exactly in their lane, I'm encouraging you to do this, will say, this is not an area that I have that much expertise in, but my colleague from Florida is, and she can speak to it. And you all exchange permission with each other to be available when a journalist calls, or maybe you're getting on a flight to go to Hawaii on holiday with your best friends. You don't want to stop and miss that flight, so have in your pocket, with permission, other nurses who you can use and tell a journalist, I can't do it right now, or first ask, are you on deadline? Maybe they're doing a long piece and you can come back from your vacation to Hawaii. Or they may say, I'm on deadline, I gotta get this story in by 6 o'clock, and that's when you say, my colleague can take this. So that's, I wanted to also acknowledge, if you don't know MK Zerwick, she's a nurse. Her Twitter handle is Comic Nurse. She uses cartoons to educate the world. And she did all of these cartoons for us. So media reach out to a nurse as a source in your health stories, and nurses make your expertise known. So I'm going to go through some tools that you can use for strategic communications, but I want to pause and see if anybody wants me to slow down. I know I'm a New Yorker. I'm used to talking fast. I grew up with 3 siblings. If you didn't talk fast, you didn't. I was a third child. You know, you didn't get the word in. Also, we used to talk politics and fight at dinner. And sometimes when a friend, we weren't fighting. We were disagreeing. And my parents encouraged that, and sometimes friends would come over and I'd be walking them to the door and they'd say, "Your family fights at dinner." And I said, "We weren't fighting, we were talking about politics. But you talk loud over each other." I'm like, "We're a loud family, we're the loud family." And I bless my parents for that, because they also said at a certain age, it couldn't only be an opinion. If you were coming to the table on an issue, you better have your facts lined up, because we're going to challenge you on those facts. I think it also gave me the gift of gab, which you see I own, and we all have this opportunity in whatever way. And for some of you who may have felt like I would never be on radio, I would never be on TV, think about writing an op-ed, think about writing a commentary, and I'll get to more of that. Not everyone's comfortable being on camera. We all think we look different. I do too. Like when I see pictures of myself, I go, "That's how I look." When I listen to myself, when I first started radio, the producer used to say to me, "Don't go home and listen to this right away." And I'd say, "Why not?" And he said, "Give it 24 hours. I used to think I had this deep Lauren Bacall voice, if you youngins know who that is. And then I listened to myself and I'm like, I don't sound like Lauren Bacall at all. I have this squeaky little high voice. Any thoughts? Should I keep going?
Yeah.
All right, I'm going to keep going. So, framing and messaging. This is the heart of any effective communication work. And I couldn't have been better set up, not only because it was a brilliant hour and a half. Representative Cannon just gave you every example. Who are you talking to? Is it an opponent? Is it someone who supports you? Is it someone in the middle? And you're trying to persuade them to come to your side on this issue. Is it someone you want money from to start that not-for-profit or to fund your additional work at the clinic that you're working in? Know where they stand. Do your intel, do your investigation. Find out if they voted on that before and in what way. Find out if there's anybody in their family who's living with this issue, right? This is how we find out a lot. Of course, it has to be public information. Or you can dig a little bit and find out stuff about people all the time. If you understand framing and messaging, you will be able to do any kind of communication work, including running for office. So this is the big question. Who am I trying to reach, and what do I want them to do? Okay, is anybody in a position who would like to take a chance on who am I trying to reach and what would I like them to do? Please, hi.
I'm trying to reach.
Okay, please stand up, say your name and your state.
My name is Lizabel Matos, North Carolina. I'm trying to reach Latinx LGBTQ populations, and I would like for them to engage in PrEP use specifically, but more HIV self-protection.
And say the last part again.
HIV self-protection.
Okay, great. So where will you find these wonderful youth you're trying to help? Where would you find them?
The community. In like my community in Mecklenburg County,
Yeah.
That's where I'm at.
Yeah, how are you finding them?
I'm trying to use social media recruitment, but I'm also attending events like, since we're in Pride Month, like Latino Pride events.
Great. So, and what do you want them to do?
I would like for them to know what the options are in terms of our county and what we have available for PrEP, because we do have free PrEP in our county because we're ending the HIV epidemic jurisdiction.
Okay, they may not know about it. They may not know it's free. They may not know that you're on their side, right? So these are youth that, also I can tell you, I talked to a journalist a couple of years ago and I said, you're not reporting on HIV/AIDS enough. And he actually said, and this is a good person, this is a senior reporter, people are kind of tired of HIV/AIDS. I said, what? People are tired of it? We have a whole couple of generations who don't know about PrEP. We have a whole couple of generations who don't know what the incredible loss. I always think about it, especially during Pride. In my city, I live in New York City, it was a devastation. And I worked in dermatology at that time. It was before I was a nurse, I was a medical assistant. When Kaposi sarcoma, what is it? Kaposi sarcoma.
Yeah.
We had no idea what it was because it was rolling out on the West Coast. It hadn't seen itself on the East Coast. We saw a lot of, mainly at that time, gay men. So we're not tired of it. just so you know. We are not tired of it, and you need to get journalists in your community on board to help you with this, and I'll help you with it. So here's why, because media is going to get you on agendas. It's going to help you with grassroots mobilization. I'm a 60s chick, so, you know, in the streets and anywhere you can find us. And also media advocacy. What do I mean by media advocacy? A lot of journalists will tell you, I can't use my space to advocate for an issue. Well, yes, you can. The way you frame your story is advocating for an issue. This two-sidism you'll see in more progressive journalism, I don't always feel like I need to hear from the other side, because the other side's not using science, they're not telling the truth, they're not representing communities that you're serving communities that need to be heard, and you're advocating for them using what's called media advocacy. So what is framing? It's really shaping your message for different audiences. As we spoke about, is it someone who's, you can even do this exercise on your own. Who are the people who are advocating on the issue that I believe in? Who are the people who are the opponents? And who are the people in the middle? And who do I want to try and talk to first? We always want to talk to the people who support us first, right? But we can't forget about the people in the middle who could just possibly be swayed by your scholarship, expertise, persuasiveness, persistence, relentlessness, all of those things you are capable of. What I like to tell people is you need to know what the values, beliefs are of the person you're trying to frame an issue for. And again, narratives are stories and statistics. So remember, we can't, how many of you listen to radio or watch, or the TV's on while you're getting ready in the morning? What do you remember most about a story, particularly if it's health focused? What do you remember most? If someone's giving an update on an issue, what do you, as you're making breakfast, lunch for everybody, getting dressed, thinking about what your day is going to be like, if you're listening, what do you remember most?
Personal experiences.
Personal experiences, the stories, right? And you're all amazing storytellers. That's why you're in this space, right? You want to tell those stories. So collect those stories. My friend who answered that question, you are collecting those stories for your future doctoral dissertation, right? That's what you're all doing. And a message plan is, again, I'm going to repeat myself because it's this simply profound. Who am I trying to reach? What are their values, beliefs, and priorities? Why am I trying to, what do I want them to do? And are you trying to raise an issue or awareness? Are you advocating for legislation, or maybe a bill that's been passed that never got funded? Or a bill that's been sitting way too long that needs to be re-upped? So these are the considerations. Also, there's another fellowship that Diana and I are speaking to out at UC Davis, the Betty Moore Fellowship. Many of them are doing innovation with, maybe some of you are as well. Anyone here creating a technology for their doctoral dissertation? Or you are?
Okay, I'm not yet.
Yeah, but let's hear what it is. Yeah.
I think I spoke about it before. Enyo from Oregon. My hope is to create a digital system between pediatric primary care centers and school districts so that we can communicate better about the care needed for each student.
Awesome. Are you going to work with school nurses?
Yeah, right now.
Yay, we love school nurses.
Yeah, so I'm transitioning to a school-based health center role. And on the site, school district nurses are on site, mental health is on site. So I really want to, we're there, but we're not integrated.
Awesome.
So my hope is to integrate.
Great project. Thank you for sharing that. So you will be working with wanting to raise money for that, right? So you want to think about looking at the tech business area in your local, everybody used to want to be on Oprah when Oprah was on TV. I would do a media training and I'd say, what's your goal? And they'd say, I want to be on Oprah. I'm like, okay, let's start like in the local newspaper or local TV. Everybody wanted to be on Oprah. It was hysterical. I would like to be on Oprah too, but those days are gone. Although maybe she'll do something else. And so the business section, the tech business section, start following it. Look and see. The business reporters want the kind of information to launch your idea, to help you find more capital. And I wish you all the best, and if I can help you at all, please know. That's true for everybody. I'll give you my contact information. So I wanted to include that you may also want to be raising money. And I said this earlier, but I'm repeating things that are absolutely critical. You have to make the story about the health of the individuals and families and community interests as your target audience, even if you're speaking to a venture capitalist, even if you're speaking to a legislative elected official. It can't be about nursing, but again, what will happen? Now, if you're going and lobbying around the staffing issue or removing these archaic laws that are withholding the right for you to practice independently because of archaic laws and obstacles, and old white men and who don't want to see you move forward, and maybe some old white women too, that we had executive orders for 3 years. Were there any major issues that you read about that was created as a result of nurse practitioners practicing independently? Any? Right? Not one. In my own state, we're still fighting to get back on some lack of supervision issues. And I was sharing a story about a nurse in South Dakota that I knew. She was covering a 250-mile radius. She was the only primary care provider. She would drive once a week to meet the only primary care physician an hour and a half away to have coffee while he signed her charts. When he died, there would be no one to sign her charts. So we have a lot of work to do on our internal issues, but please make sure that when you're pitching a story or running for office, it can't be about you and nursing. It has to be about our people that we serve. And say it so we can all understand it. The thing that's really brilliant about translating your research into public information is you can't use jargon. When I'm interviewing nurses, sometimes I have to stop and say, "What's CHF? Tell the audience, please," you know. We use a lot of jargon. It's our language, but the public doesn't know that language. And reporters don't know that language. I have a dear friend, she's actually in Georgia. I can share it because she's public about it. Sonia Collins is a brilliant, brilliant health reporter and science reporter. And I've invited her to speak to professional organizations about how we can all up our game. And she said, "I want you to know that," and I'm sure there are people in the room who have 13 credential letters after their name. I don't even know what half of them are, right? I'm in the community. And she says, if I ask some nurses, they're like insulted that I didn't know what these 13 letters meant. And I tell you, when you're on television, that cryon, the words that go underneath you, they will not have 13 letters underneath your name. So choose the ones that matter. You have I know a nurse diabetes specialist who has 13 letters after her name. And I tell her all the time, those are lovely, but you're not going to give them to a reporter because they're not going to show up. The Associated Press just changed in the last couple of years. They only referred to doctors who were physicians, veterinarians, and dentists, not academics and not nurses who were PhDs and DNPs, and that's changed. So when you are speaking to a reporter, tell them how you would like to be identified, because now they can say, doctor, and then they might say afterwards, a nurse, registered nurse practicing. The other thing I want to say is that when we did this journalism research, we did it as a qualitative study, we had one reporter who was a health business reporter, and we called him and said, "Would you do this thing?" And he said, "Well, I never talk to nurses, I do health economics." We were like, okay, who do you think has the largest budget in most academic medical centers? And he said, I don't know. And we said, the chief nursing officer or vice president of patient services, they control the biggest budget. You should be talking to nurses. So we educated, one day at a time, we educate journalists. This is sort of, again, no jargon. Please use statistics, stories. And this I'm going to briefly go through. Do I have time? Am I good? Okay. Why a triangle? Because there's 3 sides. There's nothing magical about this. And I can share my slides with the community very happily. So it's like storytelling, right? In the middle is your audience. Who is it? You can say it's the general public, that's okay, but think about it as maybe an elected official. Think about it as a board member at your institution, the chair of the board, the CEO. And then find out what their values are. We can hold off on the action, but what I want to tell you is the top line, what is the problem or the issue, is really for you. Be succinct about it. What am I really trying to ask, and what is the issue? And then the first message would be, again, it's not a paragraph, bullet points here, the problem. What is the problem? And then the second message is, why does this problem exist? I know that you have many, many examples. I'll show you an example that I chose for today. And the third message is the potential solution. And that would tell you what the action would be. So let's say it's an elected official, and there's a bill in the House. There's a bill on the City Council, HR 23. You know if that bill is passed and funded, it will make a difference on this issue. So you're lobbying them. I heard you all last night, some of you expressed to have better bullet points for your next lobbying experience. Use this model, and you will go very, very prepared. You can even have it on a cheat sheet, but I'm sure, because if you don't make them long, because when you're on TV, you're not going to have a cheat sheet, right? You're going to either memorize it, and if it's not exactly the same, you still thought out 3 concrete points and what you want them to do. So I chose that pregnant people, infants, and children, particularly for members of racial and ethnic minority groups, have increased vulnerability to climate change-related harm. I said there are 3 different types of audiences: elected officials, health departments. What's your local health department doing to address climate change? And then the public. So health departments, it does impact access to fresh water, food, clean air, shelter, security. And for the public, it impacts whether or not you will be able to get health services from the people who have been impacted. This is the generation to generation issue. We had 13 people in New York City die from the last flash flood because they lived in basement apartments.
Oh. Wow.
Those 13 people included adults and children. That's a generation lost. So health departments, get on it. Be involved in the climate change issues. So here's, I'm repeating the problem statement I already read. What do they want to do? They all want to get reelected. They all want to be reappointed. They want to reduce spending money. And the action here, there is actually a bill, thanks to Representative Lauren Underwood, the Mommy Bus bill. Many of you probably know it. This is one piece they pulled out. It's in committee, and it's to pass the Protecting Moms and Babies Against Climate Change Act. This is currently in committee. So message number 1, pregnant people of color and their children have increased vulnerability to climate change. This is a known fact. 2, mitigating the harmful health impacts of heat waves, extreme weather, and other climate impacts on pregnant moms is critical to addressing America's maternal mortality crisis. It should say pregnant people. And 3, health professionals and scientists working in community-based initiatives can reduce exposures to climate change risks for moms and babies. Those 3 messages are the way that you would then, if you're speaking in person or writing or on the phone, will let your elected official know that you also have this solution, which is to pass this bill. So I want to briefly talk about writing op-eds and letters to the editor, thanks to Janet, who said, I heard a radio podcast that you did, and I really want you to cover this. So again, I'm giving you an Evelyn Woods media training in 40 in an hour. However you can get your voice out there. If it's in your local newspaper that's free, in your supermarket, call the editor and say, I'm willing to do a once-a-month article for your newspaper about issues that are confronting our community. If it's your regional newspaper, and of course always nationally. Journalists read regional and local papers to get story ideas for big national newspapers. Letters to the editor. How many of you have read a letter to, how many of you have read an article and said, they got that so wrong. That is just not, okay. You remember it, or it's happened so many times? So many times. How many of you have read an article and written to the journalist and said, thank you for covering this issue. I think you may have missed a certain point that's critical to the story. Respectfully, I am available to talk with you about the next time you report on this. And please don't forget to thank a journalist when they get it right, because they're human. I always tell people, and this is really true, call me and take me out for a cup of coffee. I'll sit with you and hear what you want to talk to me about. So will your local reporters. Become friends with them. Write to a journalist, letters to the editor in response, And writing op-eds, there's something called the op-ed project. Do any of you know it? Have any of you taken a class with it? Have you? Oh, can you tell us about the op-ed project?
It's a training program that usually comes to an institution and teaches you the entire steps of writing op-eds, from actually reaching out and pitching to getting it in wherever you're trying to get it published, including self-publishing.
There you go. Have you published an op-ed?
Yes.
Tell us the title and what it was about.
Oh goodness, it
Oh.
was a while ago.
Okay, tell us what it was about. All right.
We know who that is.
Introduce yourself. Good morning, everybody. I'm Dawn Bounds. I'm from University of California, Irvine, and I participated in the op-ed project at Rush University in Chicago. And one of my op-eds was about the stranger danger being in your home, and so it talked about the dangers of online interactions between young people and potential predators. And that one was self-published in Medium, so I couldn't find a home for it, and so I put it out on Medium myself.
Great.
Was that before South by Southwest? Was it before or after?
This was long before South by Southwest.
So that's the evolution. It got to South by Southwest.
Yes. He's referring to, I spoke at South by Southwest this past spring on teen mental health and social media.
Awesome. Thank you. You can do it independently. You also should I shouldn't say should. If you're interested, go on their website. There are a lot of things you can learn without taking a class. They offer shorter periods of workshops. I try and take workshops to keep me fresh, and I always learn something from the op-ed project. So think about it. How many of you have published, in addition to our colleague, an op-ed? Which one of the many did you publish, Dr. Outlaw?
I did one on COVID and Medicaid not expansion, and it was published in a paper in Tennessee.
Nice. So the other last point that I was asked to repeat was, I have been quoted and interviewed by Entertainment Weekly a few years back on gender violence. And I've heard stories of nurses who say, I got picked up by the National Enquirer, and I'm like, good for you. And they're like, I'm a little embarrassed, I'm a cardiac nurse specialist, and I'm like, do you know how many tens of thousands of people read the National Enquirer? Don't be afraid to be published in any publication of reputation, right? I mean, if it's a rag and you totally, there are certain people I wouldn't interview or be interviewed by. But if you know you're going to be reaching that many people and you have something to say, like I've always wanted to be in People magazine, but I don't get People anymore because I don't know all these more current people who are in People. I'm like, who's that? I watch the Oscars and I'm like to my kids, who's that? So everyone used to say, I only read People in the doctor's office, and I'm like, we got it at home. And I didn't have it wrapped in brown paper in the mailbox either. That's Peggy, and we're not going to be able to see it, but let me just tell you that Peggy was the dean of City University of New York. Peggy continues to work with the homeless, unhoused population. And she tells a story. This is 1985. This was 2 years ago. I got her back in my house to do another video to show you the power of your passion. She tells the story in that video of 3 nursing students who were unhoused during their entire time in nursing school.
Wow.
And how did she find out? Because she's Peggy Rafferty. And she had a feeling something was up. And she kept every one of those stories private. One young student was sleeping in her car. One young student was couch surfing. Another student lived in a shelter. All 4 of them completed nursing school. All 4 of them passed their NCLEX on the first time. And so her commitment is to continue to work with the unhoused, and she doesn't look very far, as now her work is moving into climate crisis. So I always like to kind of end with saying, whatever your passion is, take that, like Representative Cannon said, bring that passion to the public. do it through whatever media platform is most comfortable for you. And that's how you can reach me. I'm really fast on email and text, so I don't fool around. You want to reach out to me? Please do. Thank you so much for being a great audience.
Thank you so much, Barbara, for sharing so many gems and for encouraging us to share our voices and our stories as well as the stories of the populations that we serve. We have about 15 minutes for questions since the session started late. Does anyone have any questions?
Okay, so if no one has a question right now, I'm going to interview you. Come on up here. Oh, we have a question. All right, Daisy.
I'm Daisy Lara from Pennsylvania. So my question is, I was the immediate, well, I am the immediate past president of Non-Philadelphia. Excuse me. During COVID, Univision and all of the news channels would reach out to us to try to get our nurses to get interviewed. So I've done several interviews on Spanish, Univision, Telemundo. My issue is, what kind of advice do you have for us? Because usually media has an agenda, and they will ask certain things and they'll only put like 10 seconds. So what kind of advice would you give us? How can we, I guess, not control, but kind of, yeah.
If you come really prepared, there's a couple of techniques I can tell you, and thanks for the question, Daisy. I like to think about being interviewed and interviewing you as choreography. I'm the choreographer, you're the dancer. And all dancers, while they're being led by the choreographer, also often improvise, right? Because that's the brilliance of the dance. And the choreographer who has strength and confidence, unless it's really off the mark, will allow that to happen. So it is a dance. Having said that, there are times that it could be considered a hostile interview or that you don't get to say everything you want. You're asked a question and you don't want to answer that question. So it's something called bridging. Every media trainer teaches you this. So you say something like, ask me a question that you don't think I want to answer, whatever it is.
What did you eat for breakfast?
How old are you?
It's interesting you would ask me how old I am because I actually talk about ageism. And I'm curious about the fact that our President Biden is running for election and he's 80 years old and the GOP leading candidate is 77 years old, but no one talks about ageism about that other guy. I didn't answer the question, but I bridged it to something I wanted to say because Daisy's interviewing me about ageism. So that's called bridging. The other kind of tip I can tell you is, if you do feel that you'd like to answer a question, but you're not absolutely sure, you can say, certainly to a print journalist before it's being printed, I want to check my facts on that and get the data right. May I and get back to you in the next couple of hours? Now, I can tell you that I have been on television and I made a total faux pas. I made a number, I think I made it up. My kids will tell you, Mom does that sometimes. And they're in their 30s now. So I said something that then the person who was on the panel with me on TV, she was an actuary in insurance, and she said, that's not true. And I was beet red, right? And she was right. And so how did I regroup? I said, wow, I'm really glad she's here because I blew it on that one. And I'm human, and we're all human. And I'm sure the audience thought, okay, she made a mistake. So mistakes are not the worst thing in the world. But great question. You have no control over what they're going to use. So say the truth, speak your passion. If it's absolutely an incorrect quote, that you can call the producer and or write the journalist and say, you misquoted me. Most reporters won't give you questions beforehand. I do not give you my questions beforehand because otherwise it's like stale, right? You've memorized it. I've had people come reading things. I'm like, put your papers down. We're going to talk. Put those papers away. You know all this stuff. You are the expert. We need to stop.
No. I just
want
want
to. Go ahead. Anybody else?
I wanted to add to your question. If you have a point that you want to make, I used to work with media
Yeah,
at the UN.
please.
What we would tell our reps and our spokespeople, have like your 3 main messages or 3 points that you want to express during your interview. If the reporter asks you something completely off message, make a very short response to that and then just go into your message.
That's right.
And some people will even just completely ignore the question and just go into their message.
Right. Well, politicians do that all the time. If you ever turn on Sunday morning, the Sunday morning, talk, morning, meet the press and stuff, you're like, yeah, that's not the question that was asked. Anyway, how many minutes do we have? None?
3 minutes.
Okay,
So
I'm going to
maybe
interview.
one more.
Who wants to be
David
interviewed?
has a
No,
question.
no.
I was going to show you how much you can tell me in 3 minutes.
Hi, thank
Hi.
you for the amazing presentation.
Thank you.
I think that one of the things I keep on talking about is civic engagement in nursing, that nursing is not learning to harness the power and the civic trust that has been given to them. So I think that, the essentials of politics, messaging, media, coverage is essential. And there's a single story that's usually told. Chimamanda said the danger of a single story in healthcare is usually the physicians. Where are the nurses? When we are having this masses crisis, media message, media presence is important. I do ask this question, where is our Dr. Gupta, right? It's a household name. Where is our Dr. Gupta or a nurse Dr. Gupta, that it becomes a household name so that the public can get to know who nurses are.
Exactly.
But my question would be, as we continue to, like the question he asked previously in terms of including this in curriculums.
Yeah.
We do not know what nurses know before they come to grad school or before they come to undergrad in terms of civic engagement and media exposure. I will give you a reason I say that. Less than 20% of American high schoolers graduate with adequate knowledge of civics, and civic can be a part of that media exposure. If anything, for a fact, January 20th did tell us that there is a good number of Americans who do not understand how democracy works. And
it used to be part of public school education. I think it's part of a major. I want to tell you that I've been working with Dr. Diana Mason, Dr. Carol Myers at the University of Tennessee in Knoxville. We actually published a paper in Nursing Outlook on media competencies for nurses. We have created 10 media points of competencies. We're now interviewing deans of schools of nursing. We hope to see this in the curricula. I think it should start in the baccalaureate level and associate degree level, and then all the way up through. And I totally agree with you. Engagement and public-facing information is where we want everyone to move. And any way that I can help, you can help me do that. I'm here to address it. We go to. I'm not trying to sell you my work. I just want you to know I'm available to help you figure out how you can do it in your schools of nursing as well as your professional organizations. We've been running a seminar the last 3 years for the largest nursing professional organizations about upping their game. Some of them have, like ANA, can afford to have a communications department and pitch nurses within their membership. We think every organization should have something like that. So I'm probably end of time. I have to read my final notes because I've been talking so much I lost a little bit of what I wanted to finish with. So okay, here's my question. My mission is to change who writes nurses' stories. Are you with me?
Yeah.
Are you with me? Yeah. All right, good. Speak up even if your voice shakes. Your voice matters. When we break our silence and raise our voices and support each other, we become an unstoppable force of change. We must keep going. Keep fighting. Keep your hands up. Get energized for the work ahead. Live your life in such a way that when your feet hit the ground in the morning, some people in the world shudder. Oh crap, they're awake. Thank you for being a great audience.
One more person I want to ask you something. I was just going to humble brag for Dr. Brown since she won't do it for herself and mention that she was quoted by the New York Times for her social media article, right, Dr. Brown?
Just recently. that shout out. And humble, it's not only humility, it's really helping to share. So you, Dr. Brown, do you think everybody in this room could do this?
Yes, absolutely.
Okay, so there you have complete confirmation of what we all already know. All the best to you. I'm available for a phone call, for some, you want to call me and say, Dr. Gupta just called me. He wants me to be on his show. How will I do this? And I'll say, get out that triangle. We're going to work on this message triangle together. Thank you so much.
Thank you.